Dear friend, today we will discuss the internal feature of medulla oblongata. This is medulla oblongata internal feature. Internal features. First, we draw the diagram just externally how the medulla oblongata look like. This is the pyramid. We have seen already. This is the pyramid. This is the olive. Olivary swelling. Okay, and this is the midline, and this is the pyramidal decussation. Okay, here. This is, and this is pons. And this is midbrain. Okay, here. And here this is the posterior feature. Here, this is the midline. And this is the fasciculus gracilis and the gracile tubercle. And this is the fasciculus cuneatus and the cuneate tubercle. Okay, these are the fiber of the stria medullaris, which separate the medulla from the pons posteriorly. And these are the three peduncle: inferior peduncle, the innermost and lowermost. Laterally, there is the larger one is the middle cerebellar peduncle. And here is the pons part, middle part. This is the this area here. This is the superior cerebral peduncle. Okay, here. This is the outline of superior cerebral peduncle. These are the colliculi, two upper colliculi, superior, and two inferior colliculi. And this is the upper limit of the midbrain. These are the two brachium, superior brachium and inferior brachium. Okay, so now we will study the cross section of the medulla at the three level. One is here, the lowermost at the pyramidal decussation level. This where the pyramidal fiber cross decussate, the level A. Just above here, there will be the decussation of the sensory fiber or the fasciculus cuneatus and the gracile fiber here in this region. Okay, so here second section we will take here. Okay, yeah. Section B and section C, the uppermost part here. Okay, where the olive comes, and there will be the open part. Okay, here. And this is the open part of the. Okay, here. The second level will be here, posteriorly, and the first level will be here. Okay, so at this level, at 3 level, we will see the cross section of the or internal feature of the medulla oblongata. Okay, so now come first level, the pyramidal level. Okay, pyramidal decussation level here. Pyramidal decussation level here. Before seeing the pyramidal decussation level, now first we draw the diagram of spinal cord, because the spinal cord continue with the medulla oblongata. Now most of the feature of the spinal cord we will see here at the pyramidal decussation level. So many tracts ascends upwards, so they also ascend for the lower part of the medulla or the pyramidal decussation level. So first we will see the tracts, different tracts and the nuclei, what are the present in the cross section of the spinal cord here. So this is the spinal cord. Here. This is the spinal cord here. This is the anterior median fissure. This is the posterior median sulcus, and this is the gray matter. Okay, this. This is the central gray matter of the spinal cord, which in the form of the H shape. Okay, this is the dorsal horn, and here is the ventral horn, and this is the central canal. Okay, here. Now, what are the tracts in the spinal cord here? Look here. First we come on the dorsal side. On the dorsal side here, this is the posterior intermediate sulcus here. So this is a posterior column, lemniscal system here. This is posterior column or the dorsal column, where this is the fasciculus gracilis and fasciculus cuneatus, lateral one. Okay, so these are the two tracts passes here posteriorly, clear? And here on the lateral side here, this is the dorsal horn. Okay, on the dorsal horn here, and anterior to the dorsal horn here, there is the first we see the ascending tract or the sensory tracts. Okay, the sensory tracts. What about the sensory tracts? Sensory tracts are here. We have already discussed the sensory tracts on the posterior side, fasciculus gracilis, fasciculus cuneatus here. Now in this side here on the posteriorly, on the lateral side, okay, just near to, this is the here posterior spinocerebellar tract. Okay, here. Then anterior to this here, this is the anterior spinocerebellar tract. Anterior spinocerebellar tract. Okay, here. Then medial to this here, this is the this one, lateral spinothalamic tract. Okay, this one, lateral spino, and anterior to this here. Okay, this tract. Okay, this tract is the spinotactal tract here. Spinotactal tract. Clear? Yeah. Now, anterior to this tract again here, this anterior spinocerebellar tract here, this one, another, the blue color here, small tract. This is a spino-olivary tract. Okay, here. So this is the spino-olivary tract. And here, in continuation of the spinotectal tract here, this is the brown, this red color here. Here, this one is the antispinothalamic tract here. Okay, this one. This is the antispinothalamic tract. Okay, here. Thus, medial anterior to the spinal. So these are the important the sensory tract. On the right side, I am drawing the descending tract here. This is the last tract here. Here. This is the lateral corticospinal tract. Okay, here. And anterior to the lateral corticospinal tract here, in very close proximity, this is the rubrospinal tract. This is the rubrospinal tract here. Okay. Then on anterior side here, clear? Here, anterior side, there is the just near to the anterior median fissure. This is the anterior corticospinal tract. Okay, ACS. Then in continuity with here, okay, just on the medial side here. Okay, medial to the ventral horn here. This is the medial reticulospinal tract here. Okay, and then in continuity with here, and a small tract here. Okay, with separate color, just here, the lateral to the anterior. This one. Okay, anterior spinal. This is the tectospinal tract. Okay, this is the tectospinal tract, and then lateral to the tectospinal tract here. Okay, this one. This is the vestibulospinal tract. Okay, vestibulospinal. So, and then is continuity here. We have seen this is the spino-olivary tract here. Then posterior anterior spinocerebellum, posterior spinocerebellum here. So, in this fashion, these are the important tract are located in the spinal cord at the, we can say, junction of the medulla continue with the spinal cord. Now, what is the structure in the medulla at this level, or just above this when the medulla continue with the spinal cord? What is the structure? So look here, most of the features are the medulla, same as the spinal cord. It is central gray matter in the inside and outer periphery. There are the tracts, but due to the pyramidal decussation, okay, pyramidal decussation, what's happened? Part of the central matter, gray matter, cut down and separate from here. Clear? So look here. What are these? Now, first gray matter. Okay. So I draw gray matter with blue color, same color. Okay. This is same color, I think. Okay. Now, here is the gray matter. There is here the central canal. Okay, here. Now, gray matter is cut down. So, important feature here in this medulla, the lower part here, the pyramidal decussation. So, look here. These are the pyramid. Okay, here is the pyramid, and pyramidal fiber passes opposite sides. 75% crosses to the opposite side like this. Okay. Like this. Okay. So this fiber crosses the opposite side to form the lateral corticospinal tract here. So this is the lateral cortico. So 75% fiber crosses, while the 20% fiber uncross. They descends downward anteriorly to form the anterior corticospinal tract. So this is the anterior cortical. So these fiber descend down, while these fiber crosses. You can see crosses and to form the lateral corticospinal tract. While the 5% fiber, they are uncrossed, but they run with the lateral corticospinal tract. Okay, here. So these are the fiber distribution. So the most important feature in this cut section is the pyramidal decussation, with formation of the lateral corticospinal tract. Okay. Now, so due to the crossing of the fiber, now the central gray matter is cut down. Okay. So what's happened here? This is the nucleus gracilis and nucleus cuneatus here. Okay, so here this gray matter is cut down here. Like this. Okay, so this is a gray matter here. Okay, and this is the posterior median sulcus. Okay, and this is the posterior intermediate sulcus between the. Okay, so this is the fasciculus cuneatus lateral one, and medial one is this is here, and this is whole. Yeah, so this is fasciculus cuneatus, fasciculus cuneatus, fasciculus gracilis. Okay, and these swellings are known as the nucleus. Okay, this nucleus cuneatus, and this is nucleus gracilis. Clear? Now, on the lateral side here, lateral side to the corticospinal tract, periphery, here is the tract, the trigeminal tract, and the nucleus here. Okay, so separate color this ascending tract here. So on the lateral side here, this one. Okay, on the both side. Okay, so this is the spinal nucleus and tract of the trigeminal. Okay, spinal nucleus and spinal tract of the trigeminal here. Okay, it passes lateral to the lateral corticospinal tract. Okay, here. Now, the remaining thing are the same here. Remaining thing means here will be the posterior corticospinal, this is posterior spinocerebellar, anterior spinocerebellar tract here, and I think first draw the outline. like this. This is the posterior spinocerebellar. This is the anterior spinocerebellar tract here. Then anteriorly here this bellucula. Okay, here this is the spino-olivary, anterior side here, spino-olivary tract, clear. And inner side of this orange color here, this is the lateral spinothalamic. Okay, then in continuation here, spinotectal tract. Okay, then here the red color here, this is the anterior spinothalamic. Okay, here, and here are the these are the just medial to the this trigeminal tract and nucleus here. These are the reticular formation. Okay, on the both side. These are the reticular formation. Okay, here, and just lateral to the reticular formation here, or in between the posterior corticospinal, this posterior spinocerebellar tract and the reticular formation, and anterior to the trigeminal tract here, this is the rubrospinal tract. Okay, here this is rubrospinal tract, which come from the red nucleus. Okay, and then here the new features come in this here. These are the here. Okay, here the two tract here. This is the medial longitudinal fasciculus. This one, medial longitudinal fasciculus, and here the tectospinal tract here. This tectospinal tract also here is present here, but shifted towards the anteriorly because due to the presence of the pyramid here. Clear? And here this is the vestibule. This is the vestibular spinal tract which is present here anteriorly. It is also shifted slightly anteriorly here in this direction. Okay, this is the vestibular spinal tract. Okay, so these are the tracts which are present in the lower level, the pyramidal decussation. Important is the pyramidal decussation. Clear? So now if you see in the short, what are the nuclei present and what are the tracts? The nuclei present here in this is the first nucleus gracilis. Okay, this is the nucleus gracilis. Okay, here nucleus cuneatus, nucleus of the spinal nucleus of the trigeminal tract here, and here in spite of this there are the small nucleus, the accessory here, the cuneate nucleus here, which capping the here the cuneate nucleus here. This is accessory cuneate nucleus. Okay, here which cap the posterior side of the cuneate nucleus. So these are the nucleus. Okay, here which present here. Now what are the ascending tracts? If you see the ascending tracts are here, the posterior spinocerebellar tract, anterior spinocerebellar tract here, then the spinal tract of the trigeminal nerve here. Clear? Then the spino-olivary tract here, and the lateral spinothalamic tract, and the anterior spinothalamic tract, and spinotectal tract. So these are the tract which are present, ascending tract here. Now what are the descending tract? If you see, the descending tracts are here. One is there's a formation of the corticospinal tract here at this level. Okay, first. Then there is the rubrospinal tract present here. Clear? Then the vestibulospinal tract present here, and the medial longitudinal fasciculus and tectospinal tract. Okay, so these are the tract which is present here in the lower level, lower cut section of the medulla oblongata. Clear? So these are the important structure. Now reticular formation is very important because reticular formation descends downward and it control the consciousness. It ascends upward and also descends downward. Now also important here, this gray matter which is cut here from the central gray matter here, this is known as the the supraspinal nucleus here. The supraspinal nucleus give rise to the here this nerve, the accessory nerve fiber come from the spinal, and this fiber reaches up to the 5 segment. Okay, so this accessory spinal nerve come from the detached part of the gray matter which cut by this pyramidal decussation. So this is known as the supraspinal nucleus. Supraspinal nucleus. Okay, here. And from this here, at this level, there is the first cervical nerve. First cervical nerve comes because this is a demarcation. So at the lowest part of the pyramidal decussation cut section, first cervical nerve comes out. Okay, here. So there are two important another features. Second section comes from the sensory decussation. Okay, sensory decussation means the fiber of the fasciculus gracilis and cuneatus when ascends upward, now they will end nucleus and the cuneate nucleus, and from the gracile to cuneate nucleus the fiber crosses to each other at this level. So this is known as the sensory decussation. Okay, here, or lemniscal decussation. Now what is sensory decussation? Look here. Now first outline the boundary of here. So this is the okay. In this section, what's happened now? The central gray matter is detached from the other nuclei here. So this is the central gray matter, which is located around the central canal. Okay, here. Now, here then what's happened? The separate nuclei, the gracile nuclei here. This is the nucleus gracilis and nucleus cuneatus. Okay, and there is a accessory cuneate nucleus. Okay, here. So this is the gracilis nucleus, and this is the cuneate nucleus with accessory cuneate nucleus. Okay, and this is the posterior intermediate sulcus, and this is the posterior median sulcus. Okay, now what, and here is the pyramid. Okay, this is the these are the pyramid. Okay, here, and pyramid also has the this is the arcuate nucleus which kept the pyramid. Okay, so this brown color is arcuate nucleus. We will see what is arcuate nucleus. Now important is here there's a decussation occurs, the sensory decussation. So the and here this is here, and these are the tract, fasciculus gracilis and the fasciculus cuneatus tract. Okay, here these are the tracts which kept the here the nuclei, the gracile nuclei and the cuneate nuclei. Okay, here. Now, look here, the fiber crosses. Okay, these are the blue color. So, fiber crosses in front of the and separately draw this fiber. Okay, so what's happened now? Look here, just here the fiber of the gracile nucleus, and these are the fiber of the cuneate nucleus. Okay, so fiber of the gracile nucleus here crosses and reaches anterior side, and while the fiber of the cuneate nucleus crosses reaches the posterior to the fiber of the gracile nucleus here. Okay, here, or the fasciculus gracilis fiber. So what's happened now? The fiber of the lower limb, because the gracile fasciculus gracilis carry the fiber of the here and the lower limb, so they crosses and reaches anterior side, and the cuneate nucleus, which carry the fiber from the thoracic and the lumbar region here, this fiber passes posteriorly. Okay, here in the, so this a bundle of the fiber is formed here. Okay, this is a bundle of the fiber is formed here, and this bundle of the fiber is known as the here the this medial lemniscus. Okay, medial lemniscus. So medial lemniscus is formed here. It's very important to hear. The fiber of the fasciculus gracilis arises from the gracile nucleus, fiber of the fasciculus cuneatus. These are the second order neuron. Okay, the first order neuron, the posterior column lemniscus system, which ascends, and here the two nuclei, gracile and the cuneate nuclei. The second order neuron start here, crosses to opposite side, and then ascends upward in the form of the medial lemniscus here. So medial lemniscus is formed. Okay, here is important one thing. Then second here, this is the, as usual, this is the trigeminal nucleus and the tract of the trigeminal. Now here, this is the spinal nucleus and the tract of the spinal tract here. Then anteriorly, brown color. Okay, here this is the posterior spinocerebellar tract. This is the anterior spinocerebellar tract here. Then anteriorly here, this one, spino-olivary tract. Okay, then here, this is the lateral spinothalamic tract here. Then anterior to this here, this is the here spinotectal tract, this ascending tract, spinotectal tract here, and here the anterior spinothalamic tract, which is present here. The fiber of the anterior spinothalamic tract, from now onwards here, they ascends through the medial lemniscus system here. Okay, here. So this is the anterior spinothalamic tract here. This anterior spinothalamic tract, which is present here, anterior to the spinotectal tract. Now these fiber ascends upward and merges with the medial lemniscus, and they now run along the medial lemniscus system. Clear? So these are the sensory tract here. Here will be the reticular formation. Clear? And here at this level, now the new nucleus start to appear. That is the olivary nucleus. Small part now start to appear. The detailed nucleus will appear on the upper part here, upper section. But here, this is the small part of the olivary nucleus appear. Clear? Then ascending tracts are here. Descending tracts we have. Now this descending tracts here, this will be the here on the upper part here. This is the medial longitudinal fasciculus. Posterior here there will be the tectospinal tract. Okay, here. Then anteriorly here will be the lobrospinal tract. As usual, anterior to the spinal tract, lobrospinal tract here. Then here will be the here the vestibulospinal tract. Okay, and further here, this is the olivospinal tract. Okay, here. So these are the tract. Now the new nucleus appear in the central gray matter. These nucleus are here. The first, the two nucleus here appear here. This is the hypoglossal nucleus. Hypoglossal nucleus for the hypoglossal nerve. Lateral to the hypoglossal nucleus here, there is the dorsal nucleus of the vagus. With the dorsal nucleus of vagus, the lateral to the hypoglossal nucleus, and further lateral and dorsal to here, the dorsal nucleus of the vagus. The two another nucleus are here on the both side. One here is the nucleus of Solitarius. Solitarius. Okay. Nucleus of Solitarius tract. Okay, here. So these are the further. Now, new nucleus also appear here on the medial side of the this spinal nucleus trigeminal. This one, close proximity to the reticular formation here. This nucleus is the nucleus ambiguus. Okay, from where the 9th, 10th, and 11th nerve fiber arises here. Nucleus ambiguus. So here, this is the nucleus ambiguus. Okay, here, and these are the nucleus which is present in around the this is in the central gray matter. Okay, so these are the structure which is seen in the sensory decussation. And now here, these are the arcuate nucleus. Okay, arcuate nucleus here. Okay. These arcuate nucleus are the detached part of the pontine nuclei. You will see in the last diagram, okay, last cut section, the open part where you will see the arcuate nuclei and fiber, how the arcuate nuclei fiber passes into the cerebellum. Okay. So these are the nuclei in the tracts which is seen in the middle section of the sensory decussation. Now the third section we will see at the open part of the medulla. Open part means where the central canal open into the fourth ventricle. So there will be no central canal. The floor of the fourth ventricle will be seen here. Now look here. What are these? Okay. And the new nuclei appear here now again. There will be the vestibular nucleus and the cochlear nucleus. This is the outline. It looks like a butterfly appearance, okay, because the widest part of the medulla oblongata here. Okay, now what is here? Look here. First is the pyramid. This is the pyramid is seen. Okay, and outside the pyramid here, the capping of the pyramid here, these are the arcuate nucleus. Here. These arcuate nucleus are the detached part of the pontine nucleus. Okay, arcuate nucleus first, clear? Now, what are the structure here? Look here. If you see on the posterior part, they are the nuclei. First we will see the nuclei. What are the nuclei is seen here? First, this is the hypoglossal nucleus on the dorsal most part in the floor. Okay, here. So this is the hypoglossal nucleus. Lateral to the hypoglossal nucleus here, this is small nucleus. This is the nucleus intercalatus. Nucleus intercalatus, which is part of the hypoglossal nucleus here. Now lateral to the nucleus intercalatus here, there is the dorsal nucleus of the vagus. Okay, here dorsal nucleus of the vagus, same on the opposite side. This is the nucleus intercalatus. Clear? So this is the here dorsal nucleus of vagus. Clear? Now, just anterior to the dorsal nucleus of the vagus here, there is the another nucleus here, which we have seen in the first this sensory decussation level here. This is the nucleus of Tractus solitarius. This is the nucleus of Tractus solitarius. Okay, here. Now, further anterior to the Tractus nucleus, Tractus solitarius here. Okay, here in this position, there is a nucleus ambiguous. We have seen nucleus ambiguous. Okay, so these are the nuclei on the dorsal part and come the slightly lateral side. Now further here on the lateral to the nucleus dorsalis or dorsal nucleus of the vagus here, now another nucleus appear here. This nucleus. This nucleus is vestibular nucleus. This nucleus is a vestibular nucleus. Here. Vestibular nucleus. They are the four vestibular nuclei. Okay. So they are the nuclear vestibular nuclear complex. So here in the vestibular nuclei are seen here, appear in the open part. Clear? Now here this large area, this lateral to the vestibular nucleus, this large area is known as the inferior cerebellar peduncle. Inferior cerebellar peduncle, because the medulla now attached to the cerebellum through the inferior cerebellar peduncle, and in the inferior cerebellar peduncle, the posterior spinocerebellar tract enters here. It passes into the cerebellum through the inferior cerebellar peduncle. So we will see here, this is the posterior spinocerebellar tract. Posterior spinocerebellar tract, which enters through the inferior cerebellar peduncle. Okay, here. Now, lateral to this, okay, here, or outside this here, this is a small nucleus is present here. This is a pontobulbar body. Okay, here. This pontobulbar body and the arcuate nucleus, they are the detached part of the pontine nuclei here. Clear? Now, dorsal to this inferior cerebral peduncle, this here, and ventral to this inferior cerebral peduncle here. Two another nuclei are seen here. These are known as the cochlear nucleus. This is the dorsal cochlear nucleus. Dorsal cochlear nucleus, and this is the ventral cochlear nucleus. Okay, so these are the ventral cochlear, dorsal cochlear nucleus. And important the feature of this part here, there is a full appearance of the olivary nucleus. This is the principal sensory olivary nucleus on the both sides. This nucleus is a crumpled back shaped nucleus here, which is present on the lateral side of the pyramid here. Along with here another accessory olivary nucleus. This is the inferior olivary nucleus here. So these are accessory olivary nucleus which is present on the dorsal side and the medial side of this nucleus. Okay, this is the dorsal accessory olivary nucleus. This is a medial accessory olivary nucleus. Okay, so these olivary nucleus are important feature of this open part, as well as the vestibular nuclei and the dorsal ventral cochlear nuclei, along with the pontocerebellar body, along with the arcuate nucleus. So these are the 4 or 5 features which appear here. Okay, clear? Now, after this here, come on the fiber, on the tracts here. Here, this is the anterior spinocerebellar tract in continuity here. This is the anterior spinocerebellar tract here. Clear? Then anteriorly here, this is the lateral spinothalamic tract here. Okay, so here on inner side here, this one. Okay, or we can say the orange one here. So the orange color, lateral spinothalamic tract, which is also known as this spinal lemniscus. This from the spinal lemniscus. Okay, here. So this is known as the spinal lemniscus. Yeah. Now after this here, just posterior to the this pyramid here, we have seen already the medial lemniscus is formed. Okay, so medial lemniscus arranged along the midline in a large bundle like this. Okay, this is the medial lemniscus. Clear? And posterior to the medial lemniscus here we have the tectospinal tract, and further posterior to the tectospinal tract here there is a medial longitudinal fasciculus here. Okay, so if you draw, this is the tectospinal tract and medial longitudinal fasciculus. Clear? Here, and again here there is the this medial to the inferior cerebral peduncle here, inside here there is the this one here. This is the trigeminal here, the tract, spinal tract of the trigeminal nerve and the nucleus here, orange color, spinal tract of trigeminal nerve and the nucleus. Okay, the orange color one. So these are the structure which we have seen here. Now along with the in this area here we have seen the rubrospinal tract, the red color, same here, anterior to spinal tract of the trigeminal nerve. Clear? Here, then again, now here we will not see the olivospinal tract because the inferior olivary nucleus is seen here. Below here will the olivospinal tract. So here the olivospinal tract is not seen. Here only it appear due to the presence of the inferior olivary nucleus here. Clear? Then here also the spino-olivary tract is also not seen because already it ends into the inferior olivary nucleus here. So there is no spino-olivary tract and olivospinal tract here because they already end into the inferior olivary nucleus. Clear? So these are the tract which is seen here in the open part of the medulla. Again, if we revise, if we see the nuclei, okay, what are the nuclei present here? Nuclei which is present are here, this hypoglossal nucleus first, then the nucleus intercalatus, dorsal nucleus of the vagus, then the nucleus of the solitarius tract, Tractus solitarius. Further anteriorly here, there will be the here this nucleus ambiguous. Then here will be the vestibular nuclei, okay, vestibular nuclei complex. Then the dorsal ventral cochlear nucleus, and the spinal nucleus of the trigeminal nerve, clear, and the inferior olivary nucleus here, and the arcuate nucleus anterior to the pyramid, and the pontobulbar body, which is present here in the just lateral and dorsal to the inferior cerebral peduncle. Clear? Now these are the important feature. Now what about, look here, this arcuate nucleus sends the fiber and enter into the inferior cerebral peduncle on the same side and the both side and the cross side here. These fiber winds around the upper part of the medulla and passes towards the inferior peduncle, and these are known as the anterior external arcuate fiber. Okay, these are anterior external arcuate fiber. Okay, while here in this previous diagram, this fiber, okay, which fiber arises from the accessory cuneal nucleus, this fiber passes superiorly and ascends upward, and this fiber known as cuneo cerebellar fiber. Okay, here now arcuate nucleus, the few fiber also enters through the substance of the medulla, ascends posteriorly here, and then it passes on the same side or the opposite side like this, and these are the fiber of the stria medullaris here. So this arcuate nucleus also fiber passes posteriorly, okay, and enters on the opposite cerebellar hemisphere, and these are known as the stria medullaris. Stria medullaris fiber. Okay, here. So there are two important fibers in anterior external arcuate fiber and the posterior fiber, which are the fiber of the stria medullaris fiber. Okay, here. And these fiber, the cuneocerebellar fiber, which ascends upward here, this is also known as the posterior external arcuate fiber. Here. So the pontocerebellar body, this ventrocerebral body fiber which passes cerebellum, this fiber passes through the anterior external arcuate fiber and passes through this fiber enters into the same side of the cerebellar hemisphere. Clear? Yeah. So these are the pontocerebellar fiber here passes into the same side of cerebellum, while the arcuate fiber passes the opposite side of the cerebellar hemisphere. Clear? Now here the two important things are here, especially the inferior olivary nucleus here and the pontocerebellar body. Now what about the inferior olivary nucleus here? Inferior olivary nucleus here is important because here, look here, this, you will see the connection of the inferior olivary nucleus here. Now inferior olivary nucleus, suppose this is the midline, okay, this is the cerebral cortex, okay, here this is the thalamus, this is the lentiform nucleus, the caudate nucleus here, okay, this is the red nucleus, the tegmentum, and here is the inferior olivary nucleus, okay, and here is the cerebellum, opposite side of cerebellum, and here is the spinal cord. Clear? Now main input to the inferior olivary nucleus is through the cortex, okay. Cortical fiber when descend downward, cortico-spinal fiber when descend downward, they also send the fiber toward this inferior olivary nucleus. Okay, here. And spinal fiber also send when upward here, especially the lemniscus system here, they also send the fiber towards the inferior olivary nucleus. In spite of this, from the caudate nucleus, antiphore nucleus and the thalamus, this fiber also end into the inferior olivary nucleus. Okay, along with the fiber from the red nucleus. Okay, so actually these are the pyramidal system fiber directly which passes, and the other extra pyramidal fiber system which passes through the inferior olivary nucleus. Clear? Now, from this nucleus here, the fiber crosses the olivocerebellar fiber. They crosses towards the opposite side and enters into the cerebellum through the inferior cerebellar peduncle here. Okay, here. So majority of the inferior cerebellar peduncle fiber are the fiber of the inferior olivary nucleus here. Okay. So these are the fiber, the efferent fiber. What is the role of the inferior olivary nucleus? Inferior olivary nucleus act as a station where the motor signal when descends downward toward the spinal cord here. Clear? This for the intended movement, same type of the signal passes to the inferior olivary nucleus and then enters into the cerebellum to send the signal that this type of the signals are sent to the spinal cord for the intended movement. Now from the spinal cord here, we know they are the spinocerebellar fiber. So the anterior spinocerebellar, posterior. So whatever the movements occurred at the intended joint, so what movements are done here? So these signals enter through this spinocerebellar tract, anterior and posterior, and send the signal or inform this fiber to the cerebellum. So what are the fiber passes, okay, for the desired movement, and what movements actually occur? These are matched here in the cerebellum, and then cerebellum sends the signal again towards the higher cortex, the sensory cortex here, clear, and then the movements will be corrected. So this is the important relay station for the motor signal for the movement. This is the inferior olivary nucleus. Clear? So this is important feature of the inferior olivary nucleus. Now, after this, come on the applied aspect of the medulla oblongata. Applied aspect of medulla oblongata is, one is the injury. Injury to medulla oblongata. When there is a hard blow is given to the back of the neck or the lower part of the head, there may be the chances of injury of the medulla occur. And this injury may be fatal because medulla contains the important vital center, the respiratory center and the cardiovascular center. Okay, here. So patient may die on the spot due to the hard blow, due to injury to the respiratory center and the cardiovascular center. Suppose there is no injury occur respiratory center and CVS, if injury occur lower down here, so there are the tracts are present. So many tracts are present here in the medulla we have seen, and they are compactly present. So when the injury occur to these tracts, so different manifestation occur depending upon the damage of the tract. When the pyramid is cut down or the damage of the corticospinal fiber are damaged, okay, or the sensory fiber, the ascending fiber when damaged like the fasciculus gracilis and cuneatus, so the sensation of the opposite side body or less lost. So different manifestation occur depending upon the damage of the tract here. Okay, so these are the injury, clear. Then one is a bulbar paralysis. Bulbar paralysis occur. What is bulbar paralysis? Bulbar paralysis is here. There is the we have seen. This is here. I told you this medulla looks like a bulb because upper part is wider, lower part is narrow here. So in the medulla and especially in the pons, lower part of the pons, that the certain cranial nuclei are located. Nuclei of the facial nerve, nuclei of the and this hypoglossal nerve, dorsal nucleus of the vagus, nucleus ambiguus. Okay, we have seen here in this diagram here. Okay, I think this is this one. Okay, hypoglossal nucleus located here, dorsal nucleus, nucleus ambiguus. Okay, so these are important cranial nuclei. So what's happened when damage occur in the medulla, especially in the upper part of the medulla here? So these cranial nuclei are damaged and give rise to a different manifestation, like difficulty in speech, if because nucleus ambiguus and the dorsal nucleus of the vagus, they supply the muscles of the larynx, the difficulty in swallowing and difficulty in speech due to the hypoglossal nucleus also damaged, so no movements of the tongue occur, difficulty in swallowing. So these manifestations are seen in the damage of the upper part of the medulla, and this is known as the bulbar paralysis. Okay, here. Also pseudobulbar, in relation to bulbar paralysis, this pseudobulbar paralysis. Pseudobulbar paralysis. Bulbar paralysis is due to the damage of these nuclei or either the nerve which comes out this nuclei. So this is the lower motor neuron paralysis. Lower motor neuron paralysis. Okay. While what is pseudobulbar paralysis? Pseudobulbar paralysis are the corticobulbar fiber or the corticonuclear fiber which descends downward. Okay. Here from the higher cortex and in these nuclei, hypoglossal, dorsal nucleus or the nucleus ambiguous, when these fibers are damaged, so the manifestation are seen same as in the bulbar paralysis. Okay, so this is not the pseudobulbar paralysis because the manifestation are the bulbar paralysis, but defect is above the bulb or the medulla oblongata, means the descending fiber, the corticobulbar fiber or the corticonuclear fiber. Okay, so this is not the pseudobulbar paralysis. Clear? Then the vascular injury. Vascular injury occur to the medulla. Thrombosis of the blood vessels occur in the medulla, okay, which supply the medulla. We will see here now. Look here. This area, I told you, this triangular area here on the posterior side. This triangular area is supplied by the anterior spinal artery. Okay, here. While this area, lateral area, here, this lateral area is supplied by the posterior inferior cerebellar artery. Okay, while this area of the inferior nucleus, these are supplied by the direct branches from vertebral artery. Okay, here. So three types. Now there are the two syndrome occur, that is the anterior medullary syndrome, black color. This is the anterior medullary syndrome, which is also known as the Diogenes medullary syndrome. Okay, Diogenes medullary syndrome or anterior bulbar syndrome. Anterior bulbar syndrome. Okay, what happened in the anterior medullary syndrome? Diogenes syndrome. Anterior medullary syndrome. Okay, what is anterior medullary syndrome? When the anterior spinal artery is blocked, thrombosis occur. So this area is damaged here. So important three structures are damaged. One is the pyramid, one is the medial lemniscus, and here is the hypoglossal nucleus. Okay, along with the tectospinal tract and medial longitudinal fasciculus. So these structures are damaged here, and which give rise to the medial medullary syndrome. What's happened here? Here there is a pyramidal tract is pyramidal paralyzed or the damage here. So as well the loss of movement of the opposite side of the body occur. Clear? Here. Then this medial fasciculus is damaged here. There is no blood supply. So what are the loss of the fine touch, pressure, and proprioceptive sensation from the opposite half of the body. Okay, here's loss here. Along with the hypoglossal nucleus, hypoglossal nerve is damaged here because the hypoglossal nerve here comes out between the pyramid and the olive. Okay, here. So this is hypoglossal. So hypoglossal nerve is damaged. So this is a paralysis of the tongue muscle of the same side. Okay, same side. So this is known as the crossed hemiplegia. This is also cross hemiplegia, means half of the body is paralyzed and half of the tongue muscle of the opposite side is paralyzed. So this is cross hemiplegia occur where the motor fiber of the opposite side are damaged, a sensory fiber, fine touch, and the proprioceptive fiber, pressure sense fiber are damaged here of the opposite side, while the muscle of the same side are paralyzed. Clear? So this is the medial medullary syndrome. Second syndrome is the lateral medullary syndrome. Lateral medullary syndrome. This is also known as the Wallenberg syndrome, or also known as the Pica syndrome, because this is posterior inferior cerebellar artery syndrome. Because in this area, what's happened? Posterior inferior cerebellar artery is blocked here. The thrombosis occur, which supply the here the lateral part of the this medulla along with the inferior cerebellar peduncle here. Okay, here. So what's happened now? In this syndrome, here you can see there is a damage of the nucleus ambiguus, damage of the spinal nucleus of the trigeminal tract here. Okay, there is a damage of the inferior cerebral peduncle. Okay, here there is a damage of the vestibular nucleus here also here. Okay, here vestibular nucleus as well as the cochlear nucleus, dorsal and ventral cochlear nucleus damage here. Okay, here, and also the rubrospinal fiber. So these area are damaged here. Okay, the posterolateral area are damaged due to the blockage of thrombosis of the posterior inferior cerebellar artery here. Now what are the manifestation occur here, and also here this is the spinothalamic here. Yes, here in this area there is a spinothalamic fiber. Yes, in this area. Here. Okay, this area. This whole area is supplied by the posterior inferior cerebellar. It includes the this lateral spinothalamic tract. Yeah. Okay. So what's happened now? If you see, the inferior cerebral peduncle is damaged, and the inferior cerebral peduncle carry the proprioceptive this fiber from the muscle and joints. Okay. So what's happened? Loss of the equilibrium occur. Okay. Loss of the equilibrium and ataxia or giddiness occur here. Here, because the fiber from the unconscious proprioception from the posterior spinocerebellar tract fiber passes here, along with the olivocerebellar fiber passes here. Okay, so there is a giddiness occur, ataxia occur. Okay, then the lateral spinothalamic tract is here damaged. So what's happened? The pain and temperature from the opposite side here is lost. Okay, while the trigeminal nucleus and the tract of trigeminal nerve passes here. Okay, so the pain and temperature from the face and head area of the same side, not the opposite side, same side are lost here. Clear? Then there is a nucleus ambiguous here. This nucleus ambiguous is paralyzed here, damaged. So this nucleus ambiguous supply the muscles of the pharynx and the larynx. So difficulty in the swallowing and the speaking or the speech. Okay. Then vestibular nuclei. The vestibular nuclei are paralyzed here. Okay, so vestibular nuclei, this may vomiting occur, the stigmas and tinnitus occur here, because this also is responsible for the balancing here. So vomiting, the stigmas and the tinnitus occur, giddiness occur here, or the vertigo occur. Clear? So these are the manifestation and descending autonomic fiber. descending autonomic fiber here. I told you the reticular formation here, okay, is present here. Here, the reticular formation here, then descends downward here, and reticular formation is responsible for the autonomic function. Okay, so the descending autonomic fiber. So what's happened? This is ipsilateral Horner syndrome occur. This due to the Horner syndrome. Ipsilateral Horner syndrome here, where there is the ptosis occur, meiosis occur, okay, and ophthalmos, anhidrosis, and loss of the ciliospinal reflex here, because the descending autonomic fiber are damaged, which supply the thoracic lateral column, autonomic lateral column here, okay. So ipsilateral Horner syndrome. So these are the manifestations. So if you again revise here, first here damage to the inferior cerebropeduncle give rise to the ataxia and the giddiness, clear. Then the lateral spinothalamic tract is damaged. There is a pain and temperature of the opposite side, sensational loss. The trigeminal nucleus and tract is lost. The pain and temperature of the face and the head, the same side is lost. Okay. Then the nucleus ambiguus is damaged. There is difficulty in the speech and the swallowing. Okay. Yeah. And the vestibular nuclei are damaged here. There will be the vertigo occur, vomiting, okay, nystagmus. Cochlear nuclei are also damaged. There may be the loss of the hearing or deafness occur if lesion further ascends upward at the ponto medullary junction here. Okay, so these are the, and also here the descending autonomic fiber are damaged. So it gives the ipsilateral Horner syndrome. So these are the manifestation occur in the lateral medullary syndrome or the Wallenberg syndrome. Okay, so I think this is all about the medulla oblongata, the internal feature we have discussed today, and the clinical aspect of the medulla oblongata. Thank you.